I want to say hi to all the nurses, and just want to call out that we are really focused on the culture of safety survey, and nobody knows better than you do whether the environment for our patients and for you is safe. We want you to have a safe work environment because we so appreciate you. We know that you're taking care of our patients, our community, and we thank you for taking great care of them. We thank you for creating a safe work environment, and we thank you for the great job you do every day.
The theme for Nurses Week this year is a culture of safety. It starts with you. And that statement speaks volumes. It really says to us that safety is everyone's responsibility and there should be no hierarchy. Safety really means that everyone's voice is empowered to speak up. And these words are very important words, but as an organization, we need to embrace them to really make them come to life. The Chester County Hospital, along with the University of Pennsylvania Health System, has recently completed a culture of safety assessment. We're in the process of getting the results together, and then the next step would be disseminating them out to everyone in the organization. If we find that there's areas for improvement, those areas need to be addressed. Also, during our magnet journey and our journey now to redesignation, we aligned our structures and processes with the 5 components of magnet. By doing this alignment, we really help to develop a culture of safety, and ultimately that results in improved patient outcomes.
The culture of safety is paramount on Fort Lasko. We want to make sure that our patients are safe in every way and every day. We recently initiated a program for falls prevention here on Fort Lasko Tower, which includes a video at admission for all the patients, so they understand that it's very important to us to keep them safe.
The critical care areas have implemented safety huddles. At the beginning of each shift, the off-going charge nurse and the oncoming staff nurses review specific concerns about every patient regarding their safety. In that way, anyone can help assist in a patient need at any time in the day, whether it's their specific assignment or not.
First, let me wish everybody a happy Nurses Week. Nurses Week is always an opportunity for us to reflect on what our nurses mean to us. Nursing is always there. Nursing is kind of like the background signal of safety. And physicians usually say that nurses are their eyes and their ears and their hands and their hearts when they're not there able to take care of their patients. And for all these reasons, we so value what our nurses do for our patients and for keeping them safe. So thank you once again.
Our department integrates culture of safety in all of our education. One of our projects is active patient identification. Each time a nurse or care provider goes to a patient bedside, they should ask the patient 2 questions. Tell me your name, and what is your date of birth? Integrating active identification is a wonderful way to use the culture of safety in nursing.
When you take a look at patient safety, the ERs are a very high-paced, very fast-moving, very critical area. But the most important area that you need to address is the area of vulnerability. In our emergency department, vulnerability, believe it or not, is in the waiting room, and it's also as you first enter the department. We've put in a role which is called the first arrival nurse. When you arrive to the emergency department, you're greeted by a nurse, and you will see that nurse for the next several hours.
Our department has utilized a number of different things to create some safety initiatives on the floor. The newer ones are our postpartum mood disorder screening and a safety contract for our patients. The first one was developed by a multidisciplinary team in order to assess the risks for all our patients in the postpartum period for developing any kind of postpartum mood disorder. The second one is a patient safety agreement. In light of patient falls, infant falls are also included in that.
Patient safety begins with our nurses, who spend time educating our families so that they can care for themselves in a safe manner at home.
In the OR, we have a team approach to patient safety. I'd say the greatest safety initiative is communication among team members. Just being open and sharing information that's pertinent to the patient's care really adds to the patient's experience of having a great outcome.
So I wanted to thank all of you, nurses as well as every single person in the hospital, for your contributions to the culture of safety at the organization, and wish you all a very happy Nurses Week.